Hi, Jessica here, representing the Davenport House Clinic, beginning a series of simple exercises that we can all practice on a consistent basis that will help to relieve back pain. The first exercise we have here is a back stretch. First of all, we want to come down to a supine position, grabbing a hold of one of the thighs and using the strength of the thighs to push against the hands will help us to slowly roll one vertebrae at a time down onto the mat. Okay, and then we'll keep the feet on the mat, hip width apart. We'll bring the arms to a T position, so the wrist is straight out from the shoulder. Okay, palm of the hand can either face up or down, wherever feels better. And then we will lift and shift the hips. So I'm going to lift and shift my hips to the right first, so then I can lift the knees and slowly roll them down to the left. Okay, keeping the feet stacked, the the knees stacked, and the hips stacked. Okay, we also are going to want to lift and shift the shoulder blades so that the chest is open to the sky, shoulders down away from the ears. Okay, and the final step is to turn the head to look away from the bent knees. So, obviously this turning of the head motion is going to incorporate the entire spine in the twist. So if that does not feel good, we can keep the head looking straight up. Okay, and then when we're ready to switch sides after, I would say 7 to 9 deep breaths. This is a really intense twist, so the longer we hold it, the better. Because with each exhale of the breath, we are releasing more into the pose and allowing the body to realign itself. Okay, so the longer we hold this, the better, the more enjoyable it will feel. And then when we are ready to switch sides, let's do so on the exhale of the breath, first bringing the knees up and then dropping the feet. And then we'll lift and shift the hips to the left this time. So then we can lower the knees to the right. Okay, keeping a close eye on our alignment, okay, because we want the hips, the knees, and the feet all stacked and in alignment. Okay, and lifting and shifting the shoulders to keep the chest open, turning the head if that feels good. Seven to 9 deep breaths here. Allowing the body to relax and release deeper into the pose with each exhale of the breath. And when we're ready to come out of the pose, we'll bring the knees up on the exhale of the breath. Bring the feet to the floor. Well, and you know what? Actually, I'll just bring my arms up over the head and roll over onto the side so I can come back to a couple. Okay, so now from here we can move on to the next exercise we have lined out for you guys to relieve back pain is the lunge. Okay, so for the lunge, we can start with the feet hip width apart, a little bend or deep bend in the knees, and on the exhale of the breath, we'll step one foot forward and then put a bend into that front knee. Okay, and the back knee as well. And then, we want to check in with our alignment, of course. So the knees above the ankle. And actually in yoga we would keep this back leg straight. So if it feels better to keep the back leg straight, then please do that. But it does require the hips to be open, especially those hip flexors. So if that causes pain, then certainly keep that back knee bent in the lunge. And just like in most things in yoga, we can flow with this pose. So we can go into and out of the lunge, switching sides. Okay, this will burn more calories, get the heart rate up. Okay, but then it might lead to injury just because we're not really paying as close of attention as we should be to our alignment. So after you've flowed with it a few times, it is really highly recommended to hold the pose and then take a closer look at the joints and how they're stacked. We have one-legged balance. Okay, so starting with the feet hip-width apart, we'll put a bend into one knee, and we'll reach back with the corresponding hand, grab a hold of the ankle, and pull the knee down using the strength of the thighs. Okay, quadriceps especially will be contracted and reaching down. Okay. Now, if this is not attainable, maybe the hamstrings or the quads are really tight today, we could use a strap to help assist. Okay, now if you don't have a fancy yoga strap, anything long will do, like a tie or a scarf. And then what you can do is align it on the ankle and then just grab a hold of the strap. Okay, so if you're not feeling flexible enough to put such a deep bend in the knee, then you can use that strap. You'll still benefit from the pose, it just won't be quite as intense. Okay? And then of course we always want to switch sides, so maybe after 3 to 5 breaths on one side, you can switch and put a bend into the other knee, grabbing a hold of the ankle. Bringing the feet to the mat, hip width apart. What we're going to be doing is a pelvic tilt. So, essentially what we're doing is we're tilting the pelvis so that the entire low back, well, the entire spine, but specifically the low back, will be pressing down into the earth. Okay, because as you may notice, when you're not engaging the core muscles and you're just kind of laying here, there's going to be a little bit of an arch in the low back. Okay, so by contracting the abdominal muscles and tilting that pelvis, we're going to be flattening out that spine onto the earth. Okay? And we could flow in and out of it, but it might be more beneficial to simply hold this pelvic tilt, keeping that back flat to the mat for 3 to 5 deep breaths. The final exercise that we have prepared for you guys to help relieve back pain is an alternating knees to chest pose. So for alternating knees to chest, what we can do is on the next exhale of the breath, we'll bring one knee in towards the chest. On the inhale of the breath, we'll bring the knee into the chest. And then as we exhale, we'll lower that foot back to the earth. Okay? Next inhale, we'll switch. So we'll bring the opposite knee in, and then exhaling down.